It's important for us as physicians to provide resources for our patients. If we can't do this in person, then we really need to provide pamphlets and have posters in our clinic that specify resources for sex trafficking.
One thing that has helped me open up over time was seeing pamphlets about sex trafficking and seeing, just reading them in the hospital. I've seen them in hospitals, and it doesn't necessarily make you talk to the doctor right away, but it makes you realize that it is something that people may understand, and it makes you, while reading it, it makes you realize the situation that you're in and the help that is available.
If they are ready to get help, you ask things like, do you want to speak with one of our social workers? Or do you need the phone number of a safe place to stay? Or can I walk you over to the emergency room where somebody might be able to get in contact with security or child protective services, or, can I help you in some way?
Was there somebody growing up who you felt like you could turn to and you felt safe with? Maybe we could call that person and see if they could come to the hospital tonight and pick you up.
And you know what? Maybe give the kids some food, because chances are if they're really out there in the life and caught up in the street, they haven't eaten.
If you are going to prescribe medication, then they may not have the money for that. So it will be important if you can find out if there are any resources in your whatever you are practicing, to be able to also provide the medication for free.
Secondly, it's important for us to protect our patients' identities, to keep their information confidential. If we don't, their life and their health could be in jeopardy.
I've left the life several times, and he would show up at my job, he would show up at my school, he would threaten to hurt my sisters. So after a while, you just realize it's not worth it.
Maybe leaving right this second isn't the safest way to leave. Maybe we need to take some steps first. Maybe we need to think about kind of, how do you get the person's ID out of the house and make copies and leave it with the service provider so that when they transition, right, what are we need to make sure there's a shelter for them to go to.
If we do provide resources in person, then an ideal way to do this is in a non-written format. The National Sex Trafficking Hotline is 888-3737-888. It is easily memorized, and a patient can walk out of the clinic with that information.
Ideally, if you're at a hospital or a clinic, when we used to do street outreach, we'd give out 1-800 free healthcare cards. Because healthcare kind of isn't one of the things that is seen as like, there's going to be lots of intervention, and pimps, but they also may call.
Some of these women do have access to cell phones.
The only reason we had phones was because our pimp needed to keep track of us at all times.
While those records might be looked at on a daily basis, a program like Snapchat allows you to text in information and get back information that vanishes then basically in thin air.
So if you're giving them a card or a referral for a service provider who is very clearly kind of an anti-trafficking organization or working with you, maybe write that number down as an X-ray place, or write something else so that they're not taking a number home that could ultimately get them in trouble.
Engaging resources is not a simple process. Many of these patients came to be in these situations through very complicated means, and because they really had no one else to go to. So we as physicians need to have done a thorough assessment of the resources available. We need to understand the risks to our patient, and then we need to connect them with known resources to help them get on that path to recovery.
My vision now is, my eyes are hoping now. I want to finish school, I want to have a good job, I want to become a nurse. And I honestly, being in the life kind of messes your head with the whole male having a relationship and everything, but I still believe in love. I still want to get married, I want to have kids. I want a normal life.